My name is Jonathan Rossiter. I'm a consultant ophthalmologist, or otherwise known as an eye surgeon, based in Taunton in Somerset. Refractive lens exchange is really an extension of my cataract practice and is a viable option for vision correction surgery for those people over the age of 50 who are fed up with their contact lenses or glasses. It's essentially the same operation as a cataract operation, and because of that, we're sort of killing two birds with one stone, so the patient will never need a cataract operation later on. Furthermore, patients can benefit from the same premium lenses, and we can treat distance as well as near vision and astigmatism at the same time. When it comes to both of these procedures, I operate usually on a Thursday, 3 times a month. You will be admitted to a lovely private room with the nursing staff looking after you. A pellet will be put into the eye to dilate the pupil. I will come along and discuss the surgery with you and consent you. You will be brought to the anaesthetic room by the nursing staff, either walking or in a wheelchair. Once you are there, lots of anaesthetic drops to numb the surface of the eye, and the pellet will be removed. Then you will come into the operating theatre and sit on what looks like a dentist chair. That will recline you into a comfortable position that facilitates the surgery. Once I've cleaned around the eye, we'll cover your eye in a paper towel which has fresh air underneath it. It's like a mini tent. And through that, a spring will be put in to hold the eyelids open so you don't need to worry about blinking. For those individuals who feel particularly anxious about the idea of cataract surgery, or perhaps get claustrophobic, we have got the options of a mild sedative on the day of surgery, and I'm usually able to reassure people and perform the surgery. I'm still under local anaesthetic. But for those people who perhaps are severely claustrophobic or very, very anxious, there is the option of a general anaesthetic, and this is certainly possible should you wish for that. We then operate down a microscope, which is quite a bright light that will hover above you, and reassuringly you will not see anything nasty coming towards you, just a bright light with shadows, colours and movements. Surgery time is quite quick, usually 8 to 10 minutes for one eye. And afterwards, once the nice new lens has gone in, we'll cover the eye just in a clear shield, which facilitates good vision for navigating around and self-caring almost immediately. The shield is left on overnight, and the next morning it's taken off. Drops are started 4 times a day, which are combined antibiotic and anti-inflammatory drop. They last about a month. I always telephone my patients the next day to ensure they're happy with how things are going and with the instructions, and then see you for a checkup 2 or 3 weeks afterwards. As I've said before, I'm always available for any problems, or if on holiday, colleagues are. 98% of cataract operations go smoothly. There are rare chances of serious complications like infection or bleeding, but those risks are less than 1 in 1,000. I'm pleased to report that none of my patients have ever had that type of problem in over 10,000 cases. There are other smaller problems that can arise which are not serious and rectifiable, but about 1 in 500 people may need a second operation. The aftercare is quite straightforward. There are a lot of old wives' tales saying that you mustn't bend, but that's not true. You can bend carefully and gently. What we would advise is no heavy lifting or straining, gardening, heavy housework for 2 weeks or so. Light housework is okay, and many people are a bit disappointed by that. Joking aside, the recovery is usually very quick and easy. Driving is usually possible 24-48 hours, particularly if a premium lens is used, and returning to normal activities after 2 weeks. So thank you for watching this video. I hope you found it informative. If you would like an appointment to see me, you can find my contact details on my website, jonathanrossiter.com, where my secretary's email and telephone number are, and also the telephone number for the Nuffield if you wish to make an appointment. And should you do so, I'd be delighted to look after you.